sedentarianism is directly related to cancer, stroke, heart attack. How was the association between sedentarianism and chronic disease, and even chronic disease complication, were proved, were tested? It's not easy. However, the answer is through rigorous studies, epidemiological studies. They follow a design. Some studies were longitudinal. They studied cohorts. They asked the people, do you exercise? How often do you exercise? And they followed these interviewed people through years until they developed chronic disease, and finally they passed away. So in that way, they associated the sedentarianism and chronic disease. Of course, you can do this also in the laboratory level, in the clinical level, different issues. But in all of them, evaluation is very important. Thanks to the evaluation designs, is it possible to associate now sedentarianism and chronic disease, sedentarianism and cause of death. In the beginning, it was not like that. The first designs brought us a possible association, then a probable association, or maybe the other one and the next after. But after more rigorous studies, the association became a medium association, a strong association, and finally a decisive association. And all of this was possible thanks to evaluation designs, epidemiological studies, evaluating communities, evaluating lifestyle, evaluating clinical trials. I'm happy now you know the purposes of evaluation. I'm happy because you know the designs of evaluation. But in this week, we are going to enter into a very nice chapter, reporting evaluation. How many times big promoters lost the sustainability of their programs into a community because of lack of funding, because they never reported the evaluation. In other occasions, some evaluators or some health promoters lost additional funding because their evaluation did not or were not accepted by the grantors. So writing evaluation reports is an art. Publishing evaluation reports is an art. I remember ADRA, a big international organization, Adventist international organization, was doing a report in a South American country. And to hand the report of evaluation to the Ministry of Health and to the authorities, they did several activities. And one of the activities were learn lessons. They invited the leaders of the country to a very fancy hotel. And there they presented through videos and PowerPoint presentations, attractive, and through a conference, all the results, all the report of the evaluation, and all the lessons they have learned. Of course, the government were impressed, and not only the government, all those sponsors that supported this job, they gave them more funds. So it's an art to write an evaluation report. While we study this week in our lecture, in our books about evaluation, enjoy and become a good evaluator.